I am Dr. Tarun Jeloka. I am a senior consultant nephrologist in Aditya Birla Memorial Hospital. As you have witnessed from China and Italy, people who are of older age, who have diabetes and other comorbidities, they are more likely to be affected with COVID-19 virus. And our patients, renal patients, they are inherently comorbid and their immunity remains to be low. And that is why there is no reason why COVID-19 will not affect kidney patients. I think they will be affected more as compared to general population. So what precautions should we take in our department? So I would like to highlight some general measures which will help preventing COVID-19 spread in our unit. As also has been seen in one of the centers in Wuhan, where about 37 of 230 patients and 4 out of 33 staff technicians got affected with COVID-19. So the risk in our patient population as well as healthcare professional is very high. So we have to take precautions to prevent its spread in our department. So for patients, what I recommend is, number one, as everyone has been telling, is about personal hygiene. So proper hand washing, use of medical grade mask before coming to the unit as well as during dialysis procedure. Liberal use of hand sanitizers both by patients as well as those who are accompanying them should be practiced. If possible, they should avoid public transport. They should utilize their own transportation if it is possible and feasible. I also recommend that they should avoid clustering or grouping even in the waiting area. They should maintain some distance which will prevent spread from one person to other. They should come one by one to the dialysis unit rather than coming in groups or clustering. If any patient has fever or has cough or sore throat, they should inform the counters or the concerned person in advance so that adequate measures can be taken to isolate them. Nurses also should measure the temperature routinely for all dialysis patients, which they are anyway doing, and if anyone has temperature, should be flagged and necessary steps should be taken. Apart from this, there are also suggestions that if possible they should avoid eating while on dialysis. Many of these patients do feel hungry. They may need food. In such situations they can have, but eating during dialysis can help spread of their saliva or the viruses in the surroundings. There should be certain distance maintained between one patient to the other patient so that there is minimum amount of spread of the virus. Even there are suggestions for staff, technicians and nurses working in the dialysis department so that they should not go in groups for dining. They should go one by one, take turns rather than having a group. It's also suggested that group discussions and grouping in the dialysis unit should be avoided as far as possible, at least for the time being when the propensity of this virus spread is very high. So these are some general measures I would recommend to all patients and all dialysis units to take care of. And if, God forbid, somebody develops a COVID-19 infection, then ideally speaking, they should be sent to a facility where negative pressure isolation room is available. If that is not available, then probably higher centers where strict isolation, strict dedicated nurses, technicians can be deployed should be practiced. I think with these general measures, because see, there are no hard evidence available. What we are discussing is from evidences or from experiences which other countries have already faced in last 3.5 months. So as and when newer antiviral treatment becomes available or vaccine becomes available, prevention is the only key to prevent spreading of this COVID-19 in our unit. Thank you so much.